Dr. Tugbiyele, thank you so much for joining us on Doctors on Call.
Thank you, Belinda. I appreciate it. Thank you. It's a pleasure being here.
Yes. Okay. So you're a board certified urogynecologist.
Yes, I am.
Okay. Female pelvic medicine and reconstructive surgery for 20 plus years.
That's right.
Okay. So let's jump right into this because I know calls are going to be going crazy. We're talking about women who have possibly given birth, having problems with when they sneeze or cough, having some incontinence maybe.
Yeah.
Okay. It affects more than half of all women who have had children, bladder leakage and pelvic floor problems. Why do you think so many women suffer in silence and never bring it up to their own doctor?
You know, that's a very good question, Belinda. And, you know, this happens to be Mother's Day. So happy Mother's Day to all the
Yes,
moms listening.
absolutely.
Happy Mother's Day. And the reason why this is so particularly important for mothers is this is something that happens after women start having children, right? It's something that women will notice maybe occasionally, initially when they have their babies. Of course, this is baby to raise and this is family to raise. So it's put to the side and it's not a big deal. It happens occasionally. But then what happens over time is that it starts to happen more frequently and it becomes more of a nuisance. And it goes from being a nuisance to being bothersome to being really something that affects quality of life. But women don't want to talk about it because
it's embarrassing.
Exactly. It's embarrassing. Yeah. Nobody wants to be that woman who perhaps wants to get up in the middle of a meeting or maybe in the middle of a church service or in the middle of their game with their children and be the one to be like, why, be the one to be going to the bathroom. I've had patients say, I don't even want to fly to see my children or they have to pick the aisle seat so they're not inconveniencing the people in between. Or a woman who says, I have to take extra underwear in my car because I don't know if it's going to happen. I may have to pull over. So it just goes from something that's more bothersome to be something that's more of a problem.
Yes, absolutely. Well, there's help out there. Is there a typical patient you see? Like, is there a point after childbirth where women start noticing these changes, or can it show up years or even decades later?
It can show up after women start having children, and then over time they notice that it is more of a daily thing. And some women, it may happen later in life. It may not happen after start having children, but menopause, right?
Really?
That's when the tissues change, the structures of the vagina, the urethra, the bladder get thinner, right? And these areas are connected and very sensitive to hormones. So when women go through perimenopause and menopause, then the tissues get thinner and they're not as robust. And then women can start to notice leakage as a result of hormone changes.
But did it start with childbirth or is it hormone changes in menopause or both?
It's both. It can be both. It's a little bit of both. So, with women who have had children, they can start having leakage with laugh, cough, sneeze, jump, lift exercises. Women will say, "Oh, when I can't jump on the trampoline with my kids like I used to, or I can't. I have to change after I sneeze, or if I go to the gym, I can't. I have to be the one to wear, black underwear or whatever the undergarments because they may leak and they don't want. Yeah. So that's that. Women stop exercising. They tell me they can't exercise anymore, or not as rigorously because of. I've actually had women say, during intimate times they may leak too, and that so it goes far. It goes far. But then in menopause, it's the hormone changes that can cause more urgency. That's oftentimes the one that starts later in life for women, where all of a sudden you get an urge and you didn't have an urge a second ago, and all of a sudden there's this sudden urge that you have to go. The bladder feels really full. A woman goes and this drops. It's almost nothing.
Oh, that's so frustrating.
Correct. Or the persistent feeling of having to go. Imagine trying to concentrate, being in a call or in a meeting or whatever the case may be, and you have to now stop what you're doing and have to go to the bathroom, or waking up several times at night, right? Because you feel the urge to go, and not because you really have to go a lot, but you just can't get back to sleep. So it just goes beyond. And then women leak, not making it to bathroom on time because of the urge. So.
And it makes you feel older than you actually are.
Correct.
Right. And that's not a good